COVID-19 have decreased significantly since the last reporting cycle. 34 people have died from COVID-related complications in the last 24 hours. This brings the total number of deaths to 87,001 since the outbreak on South African shores. New cases reflect the same, with only 1,634 infections in the same period. This brings the total number of confirmed cases to 2,895,976. Now, to speak a little bit more about these figures, we're joined now by CSIR Senior Researcher Dr Ridhwaan Suliman. A very good evening to you, Ridhwaan. So, it must be encouraging. Let's look through the average daily COVID-19 cases per week in South Africa.
Good evening, Sapiso. Indeed, it is encouraging, and we're seeing that all of the trends across all of the indicators are currently quite promising. If we look firstly at the number of confirmed cases that we've been reporting, nationally on average over the past week, there have been just over 2,230 new cases per day over the last week. That figure has decreased by 40% week on week, or if we scale it by the population size, it's just under 4 new cases per day per 100,000 people in the country, and down to 11% of what we saw at the peak of this third wave. So promisingly, this particular metric has decreased sufficiently and below the threshold to indicate that South Africa has now formally exited the third wave.
So, Ridhwaan, I see that Gauteng accounts for 201 of the new cases and KZN 350. Is this reflected in the average daily test positivity rate per week in South Africa?
Well, the test positivity rate on average is also declining down to 6.8%, and that's the national average. And promisingly, that is also declining, confirming that the decline in infections is real and not just an artifact of the declining testing that we have also been seeing. I think this is a good indication that we're moving in the right direction. At an average of 6.8% test positivity, it means that 1 in every 15 tests conducted currently is returning a positive result. Of course, we'd like that number to continue decreasing, and we wanted to move below that 5% target to indicate that we really have the pandemic under control again.
Okay, thanks, Ridhwaan. So now let's move on to another litmus test on how we're doing, and that would be the cases per province. We know that the provinces have not been behaving the same, and just take us through that. Are there provinces that are still more vulnerable to a peak in COVID-19 infections?
Thanks, Sapiso. So all of the provinces have surpassed the peak of their third wave and promisingly are showing declining trends now. Of course, some provinces are further ahead than others. There are quite a few provinces that have actually now also formally exited the third wave. This includes Gauteng, Limpopo, Northwest, Mpumalanga, KwaZulu-Natal, and also recently the Western Cape as well. So they've declined sufficiently below the threshold to indicate that they have formally exited the third wave. The Eastern Cape is not too far behind and will likely decrease below that threshold in the next few days. The 2 provinces still of slight concern remain the Free State and the Northern Cape. They have been showing an erratic trajectory over the course of this third wave, with a plateauing at a high case incidence and a high test positivity rate. They are both showing decreases now, so hopefully they'll remain on sustained declines going forward.
So, Ridhwaan, we had just put up the test positivity rates per province graphic, and talk us through that, and if we can also put up the daily COVID-19 cases per province for our viewers to see. I know you've already explained that, but so talk about their test positivity rates per province and what have been the major differences.
Sure. So that test positivity rate, if you look at the trends as being shown currently, they're all moving downwards across all of the provinces. So that is really encouraging and really confirming the trend in cases that we just spoke about now across the different provinces. Gauteng, encouragingly, is now reflecting a test positivity rate below 5%. And this is really where we want to be. There are a few other provinces below 10%, including Limpopo, Mpumalanga, Northwest, and KwaZulu-Natal, which is good. The Western Cape and the Eastern Cape are almost below that 10% level. The Northern Cape, however, has a test positivity rate currently above 20%, and that remains a slight concern. And as indicated a little earlier, it has been a bit erratic during this third wave, but hopefully it has surpassed the worst of it, and it will continue on a sustained decline moving forward.
Ridhwaan, the new COVID-19 hospital admissions, how is it looking? Because I understand that there have been 57 hospital admissions in the past 24 hours, and that's against more than 16,000, actually 16 million people that have been inoculated. Is that making a difference?
So we know that we don't quite have data publicly available on outcomes by vaccination status just yet, so it's difficult to make any firm conclusions without that data. I am aware of some individual hospitals as well as the Western Cape province reporting outcomes by vaccination status recently for specific age groups, but we still await more data overall for the general population. For now, we're still promisingly seeing a declining number of people being admitted to hospitals across the country. The last week saw just over 3,500 new hospital admissions. That figure has encouragingly also declined by 32% week on week, following that decline in the number of infections that we have been seeing. So hopefully this will continue to decline as well going forward.
Okay. Now, finally, let's look at the average daily COVID-19 deaths per week in South Africa. We spoke about the fact that there is a downward trend. Talk us through it, and how significant is it?
Yes, there is certainly a downward trend. And this is good news as well. We are still, however, reporting an average of 126 deaths per day across the country, which is a lot. And of course, we want that to decline much further. That figure has declined over the past week by 35%. And hopefully this too will continue to decline following its lag that we see in the declining number of hospital admissions. Beyond that, I think it's also good news to note that all of the provinces are reporting a decline in the number of reported deaths as well.
Okay. So, Ridhwaan, just your sense, I know we are working towards the 1st of November, which is going to be the local government election date, and we know that for us to get to this point, there were serious concerns raised about public health, not necessarily the systems, but whether or not we'd see a spike in infections because of voting. Would you care to share your thoughts with us, especially around the fears of a fourth wave?
Look, so the fear of a fourth wave does remain. And if you look at the trajectories of the past three waves now, as well as the timing between these waves, it is likely that we will experience a fourth resurgence towards the end of the year. It may be triggered earlier by cluster outbreaks or super spreader events if we aren't vigilant. So that still remains a concern. And I think the most concern is public gatherings and large gatherings that may become super spreader events. So I think the increase in the numbers that we've allowed for gatherings is a concern. So to try and counter that, we do need to be extra vigilant and remain cautious that we don't let our guard down and let any of these events become super spreader events. We really don't want to trigger the fourth wave sooner, and we don't want it to be much more severe than what it could be. It's still ultimately we can play a part in how long it will last and how severe it may be. So I think remaining vigilant during the election period and ensuring that we don't let our guard down is quite crucial during this time.
Okay. So just as you said, it's too early to say with regards to data. And I'm asking you this, and I know I'm asking for a lot of people who've experienced it, who've heard about it, that there are people who are either vaccinated as in fully or even partially who have fallen ill due to COVID-19. What do you say to them from a scientific perspective about vaccination and also getting COVID-19 while you're doing it?
Well, we've seen, and specifically data coming out of countries that have high vaccination rates, that it doesn't necessarily prevent the getting infected and doesn't prevent countries from still experiencing waves of infection. Case in point includes the Israel and the UK, which have very high vaccination rates, but still recently experiencing resurges in the reported infection rates. What the data does, however, show is that the vaccinations have weakened or at least broken the link between cases and hospitalizations and deaths. So while infections may still occur, the outcomes may not be as severe, and many of those not requiring hospitalization and not succumbing to the virus. So I think those are probably the outcomes we can hope for as we see that the vaccination rollout continues and continues to increase. We still, as indicated earlier, awaiting data specifically of ours on outcomes by vaccination status, but hopefully we too can break or weaken that link between cases, hospitalizations and deaths.
As always, thank you very much for your time and insights, Ridhwaan. CSIR Senior Researcher Dr. Ridhwaan Suliman. It's time for a break. We've got more news after that.